Yesterday, we went to see Dr. Clapper at his office. It was 5 days post-op, which is unusual. Normally, you wait until 2 weeks to have your first visit and get the staples removed. I've been having some drainage from my incision, which on its own is not anything to be concerned about because it's normal to have some drainage, but mine doesn't seem to be tapering off at all, and it was leaking through the dressing onto my bed. So the doctor wanted me to come in so he could take a look at it. There's no signs of any infection, and the incision looks fine, but there is a lot of drainage, and so he wants to keep an eye on it for the next couple of days. And if it looks like it's not getting any better, then I would have to start a broad spectrum antibiotic as a preventative measure so that I don't get an infection, because that's one of the worst possible things that can happen after you have a hip replacement. Part of what causes the drainage is the swelling around the incision. It sort of presses the liquid out. I know that's probably more than you want to know. And there also just the amount of fat you have under the skin, he was saying, can also increase the amount of drainage. But so one thing I have to do to decrease the swelling is to ice more frequently, which I have been doing, but I guess not enough. So basically all day, every day, I've been elevating and icing with these large ice packs for 20 minutes at a time, basically until I go to bed at night, and in the hopes that maybe that'll help slow down some of the drainage too. But it's also just a real great natural pain reliever. So I highly recommend icing after surgery. Home physical therapist came today for the first time. He said he's going to see me 6 times over the next 3 weeks. He just took a look around the house, had me walk around a little bit, just sort of got to know me a little bit first today, but he wanted to see how I was walking with the walker. And he said that the PT in the hospital told me the right way to walk with the walker, and that is to walk normally, as if I'm just have a normal stride, and step a heel toe in a heel toe fashion. So, just like I'm walking normally.
I can heal, I can mend, I can make it to the end.